My name is Alexis Smith, and I'm a primary care physician for adults and children at a safety net clinic in Los Angeles. I also teach medical students. I'm an out lesbian and am planning on becoming a parent. I struggled with my LGBTQ identity as a teenager in the early 2000s. I did not hear much about LGBTQ people or issues at home or at school, and what I did hear was usually negative. I recently learned that my home state of Arizona just repealed its no promo homo laws back in 2019. These laws placed restrictions on discussing homosexuality in a positive manner in K-12 public school sexual education curriculums. This structural homophobia had significant consequences on my self-worth and caused me to feel marginalized and isolated. Today, I am happy, partnered, and accepted in my community. There's national marriage equality, and there's more LGBTQ visibility in media. Even though there has been a lot of progress, LGBTQ youth are still struggling with discrimination. I am disheartened that 40% of LGBTQ youth surveyed by the Trevor Project seriously considered suicide in the 12 months leading up to the COVID-19 pandemic. And during the COVID-19 pandemic, the amount of activity seen by the Trevor Project crisis centers has doubled. I have pediatric patients in my clinic tell me that they are nervous to tell their family and friends about their sexual identities. Many of my LGBTQ youth patients suffer from mental health issues. According to a recent Human Rights Campaign survey, only 26% of LGBTQ youth say that they always feel safe at school, and only 5% of LGBTQ youth say that they feel that all adults at their schools are accepting of their identities. Additionally, 67% of LGBTQ youth say that they hear negative comments about LGBTQ people at home. Additionally, LGBTQ youth are still homeless. It is clear that there is much more work that needs to be done. LGBTQ teens are unique in that they are often minorities within their own families and they need our support. We need to teach children early about the existence and acceptance of LGBTQ people in developmentally appropriate manners. I believe children are old enough to learn about LGBTQ people as soon as they are old enough to learn about Disney princes and princesses. They need to learn that in some cases, a prince or a princess may have a same-sex partner, or they may be born one sex but really identify as another gender. If we do not teach about LGBTQ people, when we teach about straight people, what we are really implying is that LGBT people are either taboo or inferior. Teaching children young will help straight children become allies and stand up to bullies, and it will also help LGBTQ youth feel more empowered to be proud of who they are. Children's Hospital of Los Angeles recommends teaching children young about these issues in developmentally appropriate manners, and I have included that article below. I want to conclude with the following recommendations. Teach your children that I exist. Teach your children that LGBTQ people are from all races, religions, and work in all jobs in society. We all exist, and we are just as important as our straight counterparts. Support programs that help place LGBTQ inclusive education in public schools. A few states still have no promo homo laws. Please help to get rid of these laws. Teach your children that you will love them and their friends no matter how they identify. And teach your children to stand up to bullies. Be a supportive ally for LGBTQ youth who are still struggling today. LGBTQ youth who report having at least one accepting adult were 40% less likely to report a suicide attempt in the last year than LGBTQ youth that report not having one single accepting adult in their lives. Let's end the cycle of children growing up feeling inferior and having to rebuild their self-esteem as adults. Let's reduce the bullying, feelings of isolation, and mental health issues. Let's be the best allies we can be to the next generations of LGBTQ youth. We owe it to them. Thank you.